Okay, I'm here to do my newborn baby assessment. So when I come into the room, I'm gonna say, hi, my name's Maddie. I'm gonna be, I'm with the OCC nursing program, or Oakland Community College Nursing, and I will be performing a head-to-toe newborn baby assessment on your baby. And if any time, I'm gonna provide some education about newborn baby care. And if you have any questions during this time, please tell me. Before I begin, I'm gonna put my gloves on and wash my hands up real good and make sure the parents see this to make sure that they don't think I'm touching their baby with nasty hands, right? I got clean hands now I can touch the baby. I'm going to identify baby. I'm going to swaddle my baby. And I'm going to identify baby's wrist, like little band with mom's band. And I'm gonna ask, obviously, what's your baby's birthday and name, and what's your name and your baby's and your birthday, and all that good stuff that you would use to identify. At this time, it's really important that we place baby into a radiant warmer. We want to keep baby warm, and during this time, it's a great time to educate parents also on, yes, we have baby wrapped in 2 blankets, and yes, we have a hat on baby, but over time, we need to start adapting baby to the environment around us. Baby is used to nice warm womb with all those organs and fat, just keeping them warm. We got to start by maybe taking 1 blanket away and keeping a blanket and a hat, or taking the hat off and only having 1 blanket. We need to start adapting baby into the environment around them. And obviously, if baby's cold, let's wrap them up, keep them dry, keep them warm, provide a blanket, but let's not do it all the time. We need to adapt to baby. I will start by assessing vital signs. Baby's apical should be 110 to 160. Respiratory rate should be 30 to 60. And, we're gonna want to count both for 1 full minute. Baby's respiratory rate may be regular at first, like maybe 10-second breaks between they stop breathing. Now this is okay. Now what we're concerned about is if it goes 20 or way over 10. Now we're a little concerned and we need to contact provider. But small little breaks, normal things. But we do want to assess for 1 full minute on both, so that is what I'll do. Okay. Apical. Apical is 120. My baby is good. I'm gonna start doing lung sounds on either side for a full minute. Okay. My baby's breaths are 46. My baby isn't good. My baby is real good. Okay, and some things that we can educate parents on is respiratory distress. If your baby's nose is flaring, that's nasal flaring. Now that is a sign of respiratory distress. Intercostal retractions and use of it's gonna be your skin. If this is your ribs, your skin's coming inward. It's important to educate parents on that. Chest retractions, grunting, seesaw breathing. Your chest is coming out and then your abdomen. It should be one thing. It shouldn't be. So it's important to educate parents on that. And lastly, cyanosis. This is a late sign of respiratory distress. We shouldn't get to this point, but if you do, you need to contact the provider immediately. Now some additional signs, maybe tachypnea, but faster than that, because babies breathe really fast. Tachypnea and poor feeding. They might not be interested in eating. Okay. Lastly, let's do, my baby's lung sounds were clear and regular, and equal bilaterally. Okay, now temperature. My baby's, we're gonna lift arm, axillary, hold. Now we're going to, it's important that we do this. We don't want baby cold. Normal temp is 36.5 to 37.5. We don't want baby to be cold. Okay, 36.8. My baby is nice and in temp. Now let's do some physical exam. We're gonna check their general appearance. Now their general appearance is pink, and their movements are good. They're moving their arms, moving their legs. Now we'd be really concerned now if, like, because it's spontaneous, symmetrical. Now, symmetrical, if your baby's moving this arm and this one's just there, or baby's moving this leg and this one's just there, now we're a little concerned. Why isn't baby moving both extremities the same? And we would have to do further evaluation. Baby should be flexed. It can be flexed, it can be moving, right? Skin assessment. I'm assessing their skin color. You know, like, are they pink? Are they blue? I want my baby to be appear pink and well perfused. Like, I want their tissue perfusion to be good. We're observing for jaundice, and we can see that in their scarla, but it's kind of hard. Baby's got small eyes. We're gonna check their skin, and we're going to pop their nose, and that's a good way to palpate the nose or blanch nose and see if there is anything with that. Acrocyanosis is important to teach parents because blueness in the skin is okay in the first 24 to 48 hours, and it's a normal finding. You might see it in their little hands or feet, and that's okay. That's normal. Now the head. I'm going to support baby's head, and I'm going to start outlining their frontanelles. This one is going to be diamond shaped, and it should be soft, flat, and diamond shaped anteriorly. Now posteriorly, we got a frontanelle, and it is triangle. Should be soft, flat, and triangular. Now I'm gonna assess for Sextium, and that is when there's edema from birth, and that's gonna go over the suture line. Now you won't be able to feel it. It's gonna be edema, and it's gonna cover it. Then there is a hematoma. That is blood pooling underneath this the perineum of the skull. And this does not cross the suture line. Clavicles. I'm palpating my clavicles. Any cryptus or anything like that. You know, no cryptus, none of that, no pain, masses, they're symmetrical. Now, if there was cryptus, I'd be a little concerned that baby has a broken clavicle or something, and I'd contact the provider and stop my examination on the clavicles immediately. And may I add, forgot to mention earlier, I would feel for the pedal pulse, which may be underdeveloped, so you might have a hard time, and the femoral pulse, and I'm gonna listen. I'm gonna listen to both pulses and see if everything's bilaterally equal. Everything is bilaterally equal. I can hear the pulse. My baby's pulse is developed because he's an overachiever. Let's do assessment of the abdomen. Soft, round, non-distended. Let's listen to the vowel sounds. All 4 vowel sounds and all 4 quadrants. We're going to be assessing the umbilical cord. The cord appears to be drying, healing, no foul odor, swelling, no fever, no redness going up to the abdomen. Signs of an infection is fever, swelling, redness up the abdomen, foul odor, purulent drainage. Now it's important to educate parents. We don't want to just put diaper over umbilical cord. We need to put it underneath, as so. And it's important to tell them that don't submerge umbilical cord. Don't try taking it off. Let the umbilical cord fall off on its own, okay? Doing this with the diaper promotes good healing and prevents infection. Back in genitalia, let's go. Spinal alignment, we're checking for spinal alignment. It should be straight, intact. I'm also inspecting for that little dimple. We don't want a dimple. If there's a dimple, is there drainage? And if there is, we need to do further evaluation and contact provider. Now genitalia for males, urethral opening, is it at the tip? Is it straight? Is it right, left? If it's right or left, we might have to contact nephrology if parents want to do circumcision, because you just have to contact nephrology. And we also are going to check to see if testes are distended. Female, we're checking the labia for inflammation, swelling. We're checking if there's any drainage of whiteness or blood. Normal because of maternal hormones. Newborn reflexes. Moral reflex is baby. That's moral reflex. They're startled. And this is a normal finding. They should symmetrically expand and flex arms. Grasp reflex, my baby, I'm gonna put some pressure right here and they should just grip on to you. It's super cute. Rooting, I'm gonna swipe my my baby's cheek and baby should turn head and open its mouth. Babinski, you're going to do foot and you're gonna start here, go along this way, and baby should expand little toes and fan out. Stepping reflex, baby's gonna do little steps like this and they'll just make little stepping movements. Breastfeeding, a lot of people ask about breastfeeding. Newborns lose about 10% of their body weight in the first 72 hours and they'll regain it within 10 to 14 days. Breastfeeding infants should eat 8 to 12 times and every 24 hours as well. Normal urine output, day 1, 1 diaper. Day 2, 2 diapers. Day 3, 3 diapers. And day 4, 4 to 6 wet diapers. Now the first day for stool, 1 stool, and they're gonna be black, tarry, sticky. That's your meconium. Day 2 and 3, stools will be greenish and brown, and this is our transitional stool. Day 4 to 5, our stool's gonna be yellow, loose, and seedy. That's our breastfeeding babies. That's milky. When to call our provider. This is important education to teach our parents. A fever over 100, difficulty breathing and respiratory distress, poor feeding or inability to wake up during feedings, and jaundice that is worsening or spreading. Let's talk about choking. If your baby is choking, they can't cry or breathe, first of all, call 911. Then grab your baby, you're gonna hold them like this and do 5 back smacks right to the back and between the scapula. You're gonna flip and do 5 chest compressions. And you're gonna continue that until baby starts to cry or airways cleared up or until emergency comes. Safe sleep, we want to prevent sudden infant death syndrome. We can do that by ABCs. A being leave the baby alone. Don't sleep with the baby. Don't put baby next to you in bed and go to sleep with the baby. Back, B means back. Keep baby on back. Don't let baby suffocate. Put baby on back. C, crib. Make sure the mattress has a mattress with firm mattress with fitted sheets. No barriers on the sides, no blankets, no bumper pads, stuffed animals. Another thing I'd like to add is if baby has stuff in its mouth, turn baby's head, use a little ball, squeeze before putting in, grab and suck out. Skin to skin. This helps with temperature regulation, breastfeeding success, and glucose stability, and promotes bonding. We can do that, make sure that infant's airway is open, put baby on chest, and we can cover mom. We can do skin to skin, and this is really nice. So I have completed my newborn baby assessment. I'm going to make sure baby's on their back in the bassinet with rails up and the call light and reach of parents. And I'm gonna thank the parents. Thank you for letting me do this assessment. Let me know if you have any more questions, and if you don't have any at this time, please don't feel free to ask me later. I'm gonna wrap up my baby, make sure my baby is nice and warm, and there we go.